Friends, we are 3B Scientific. This is based out of Germany and India, and this is also into the mannequin space. So we'll have now Mr. Vishal. He'll talk to us about this. So this is over to Vishal. Uh, Vishal, hello. So we can talk about the scientific and this is four. This is day one of the exhibition. You can just take us through the mannequin.
All right.
Start from there.
Yeah. All right. Yeah. So let me take you through this IV arm. So this is made up of completely silicone, very realistic to feel. It has all the veins adult human male arm would have, cephalic and the cranial vein, ulnar vein.
So
And
the
then
drip,
yes,
there is a fluid.
we fill this with simulated blood, which goes into the system. And whenever a trainee student or medical student or a nursing student use this, they can actually draw the blood from this, the simulated blood from this. So if you touch and feel, it's very realistic.
Yes.
Yeah, touch and feel, yes. Then we have these simulated medicines. So these are the drugs for rapid sequence intubation, which is used by emergency medicine doctors to practice the emergency intubation. So these drugs have the realistic name on them. You can see the dosage, you can see the name.
Are these made in India?
No, all of these are made out of India. Some made in US, some in West of Germany, some in Hungary.
Wonderful.
Right. Yes. Right. And these, yeah. So this one we have basic BU, the CPR for basic life support, and automated electrical defibrillation training. It's again an emergency training procedures used by every medical and healthcare workers. This is the basic. This is where all of them start together to save a person from heart attack. How we save them until a qualified hyperized ambulance arrives.
Wonderful. You have to do next.
Yeah.
You want to talk about this?
We have it here. These are the posters in roll up. This is catheterization simulator. There's a male and female catheterization simulator. So it's we have very easy application and easy to change and replace them. And it's also connected with a reservoir here. So the students can actually put the catheter inside the French, I think 12 to 14 catheter size. They can introduce inside this urethra in this genitalia, and they can simulate draw urine. They do the standard procedure as per the checklist.
The male is having a prostate problem.
Yeah.
So they'll be
all, yes. And this also prompts them to do a suprapubic catheterization in case there is some internal blockage or there is any swelling or the urinary catheter cannot pass through into the bladder.
Take out this, or if you want to see the prostate gland, how it's going to be working.
That's
that also there?
That we demonstrate with the help of a separate anatomical model. Yeah. And this is for yes for birthing simulator we call. We used to teach nursing students and medical students how to deliver a baby normal situations where everything is normal, baby is lying normally in the uterus.
So if you open this, there would be a position of a baby.
Yeah, so it actually we have it out here, baby. So it's a
But the
full
same
body.
baby would
Yes, it would be placed inside as a real baby is inside a mother's
in
womb.
case of normal no.
Yeah. So now
normal delivery.
now there are breech deliveries when usually the baby is positioned like this inside, but sometimes like baby is positioned like this. Their legs are out. Sometimes the hips are out. So these are different complications of the birthing. Sometimes mother cannot push a baby outside and she's tired and she has some loss of consciousness. Maybe become unconscious eventually. So baby stuck. Nobody is going to push it. All muscles are relaxed. So that way we can do instrumental deliveries with the help of suction. You might have seen movie 3.
Are they called cesarean?
No, cesarean is different. We open up the abdomen, go through right through uterus, and take the baby out. I do not really there. So you, I mean, yes. So instrumental delivery, suction delivery, like that's from shown here itself. Yes. But then there's no chance to injury for the head. No, it's so the suction control, suction power is controlled. It's cupped face over baby's head, and then we cannot, exceed a certain limit. Is this a measurement, a real measurement? Yes, it's just a build around a real female human. And this child is also in say terms of weight or in size the same. Yes, so it's yes size. I would say not weight is approximate, but yes, then it has its umbilicus and this. Is that also the how many? It's a meter. The umbilical cord. It depends on size to size. What is the? I don't know. Yeah, I've never experienced. Yeah. So what is the umbilical cord actual? So size looks like the size doesn't matter. It's most about like it's attached to other end to the placenta, and this placenta is attached to the wall inside the abdomen. Can you open it and show where the uterus? It's difficult to show it. We'll open this now. It's here video, and then they can do cord clamping. Yeah, and then they can cut the cord also, and they can if they want to resuscitate the baby, if the baby is not breathing, they can do resuscitation. And one thing, this is a male baby or a female? How do you? Does it make any difference? No. The baby is neutral gender right now for the training purpose. We are not concerned with the gender of the baby during the birthing training. And just for this information, when we say the baby is born deformed, yeah, or like there are cases when the feet is out, breech delivery, or the feet are deformed. That is CTEV. That's the congenital dysplasia of hip, CDH, and the congenital visible in the what is that? No, ultrasound? No, yes, yes. In real life situations, that's not visible in ultrasound, but yes, advanced stages. I'm not sure about that, but we'll get some look. Yes, absolutely. So we move to the next one. Yes, so these are episiotomy, suturing models. So these are also required for training during birthing. Sometimes the baby's head is so huge that it cannot pass through the vaginal opening, because or maybe baby stuck. So they use several kinds of incisions in the vagina. So that's procedure called episiotomy. So that's how it's episiotomy. It's mediolateral or medial. They cut and then they suture it again after the birth. So all that procedure. The same model. Yes, this simulator would be the same. This could go inside this fix. Right. So and then they can do this. Yeah, yeah, yeah. So one part at a time. And we have this breast advanced breast examination. So this is a wearable breast model. Nowadays we have so many cases popping up for. This is for like what do you call the lump in the breast? Yes, yes. Okay. So this is when you feel it, what the material is. Yes, you can touch, feel, and they can do either. I mean, this is a model where the faculty can teach them how to palpate their own breast, or maybe somebody can wear this also. This is wearable, so or maybe put on a tabletop, right? Do the palpation. So it's already this will be one side is normal breast, and other side having abnormal lumps and tissues which can be palpated. Can we feel here? Yes, yes, you can palpate. Which side is that? You can see here. This is normal. Yes, this is normal. There is no lumps. Where's this? Yeah, yeah, so, yeah. And this could be like say different size. You'll have? Yes, yes. Like suppose it's a female with a lesser. No, 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 no. It's all it's slim. Mostly, it's doesn't matter. Females, yes. but sometimes male, there are very rare cases. Male
What do
breast
you call that?
also. No, 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 that is different.
Male breast surgery.
That is gynecomastia, where
Yes, yes.
they have excess, you know, uh, enlarged
So
breast
there
in
you have
males.
similarities with that also?
No,
No, no,
no.
that's not
Yeah.
same. Right. We move to this one.
Yes. So this is called Mickey the nursing mannequin. Okay. So it's also a completely life-size mannequin. We can do all nursing procedures inside this. We can do
This is
catheterization.
a patient.
Yes, it's a patient care simulator. So all procedures, the nursing procedures, plus it has these glucovitis rounds.
What is this? If you could just
This
elaborate on this.
bones. So sometimes a patient is paralyzed, he cannot move or he's in coma. So that time the patients are lying on their side, and because of their this is the
Ulcers.
yes. So this is, here is a greater trochanter, right, and greater trochanter on when we are sidelined for a long time, 2 3 days or somewhere, whole 12 hours, 4 hours. They have ischemia here, loss of blood supply due to which there are ulcer
Which
and
is
then
there in any part of the body? The lower feet, eczema.
yes, usually wherever you have maximum pressure, like here, you can see this part. Yeah,
It's a skin
yeah.
disease.
It's not a disease.
Eczema.
It happens to people who don't have any mobility. They are lying all the time on the bed. Yes.
After surgery
After no,
pre-surgery
no,
also.
comatose patient
Okay.
or paralyzed patients or patients in ICU.
Which are only water bed.
Okay.
Which,
Yes,
which
yes.
essentially have to be an air bed and all.
Yeah, yeah, yeah.
And
And
if we have if we reverse this model,
yeah,
the back,
yeah, back.
spine,
Yes,
is that also you can see?
yes.
Can we can you hold it?
We can see the internal organs inside this. Uh, like you see, these are lung lobes of your heart, and there's the stomach there.
You can
There's
just
another
one.
cut section.
Can you start from the top? This is the
This is
windpipe.
the windpipe trachea, left right trachea, and then this is heart and the large
This is the
vessels.
heart.
Yes, this is the heart. That's the lung between the heart. That's the stomach.
What is this one?
This is the stomach part. And that's lungs and
In
other
this
cut
here?
section. Yes, because
Where is our gallbladder?
gallbladder is down there. Okay. Liver and under the liver.
Kidneys?
Kidneys are down there. So if you want to see
And where's the rib cage?
rib
Up there.
cage, see this is the rib cage. These are cut ribs. You see this? This here.
This is solid. And
Yeah, you see this is a pliable material, not so solid.
this is silicone, everything.
Yeah, silicone mixed with rubber, some part. So here also you can see.
This is the intestines.
Yes, intestine, that's the ovaries.
Oh,
Yeah, left and right ovaries. That's the uterus here. Yeah,
this is what is this?
intestine, large intestine.
And where's the small?
Yes, all intertwined inside there.
Gallbladder we can see.
It's now with
And what is the rectum?
rectum is down there. Okay. And then we have this bladder, urinary bladders.
This is the bladder.
Yeah.
This is the same in the male and the female.
Yes. That's the rectum like this. Right?
So when we are talking about the catheterization, so the bladder, they had, also be in the simulator of the bladder and the
Yes,
catheterization.
yes, yes. Yeah.
Then they can empty the bladder.
Yes.
So the
That's
working
where
model means the urine is collected.
yes.
Right. And one more thing, just come to the mind, like piles.
Yeah.
You know,
Yeah.
when
Hemorrhoids.
piles,
Hemorrhoids.
people would have blood
Yes.
during the stool.
Yes. Yes.
So how is that also a
Yeah.
model?
Yes. We have a separate model for that.
Wonderful. So this is we come to the second.
So this is a trauma hemorrhage model.
Somebody has got an accident. Say
Yes,
a saw.
it's not accident. This one is specifically to treat trauma related to gunshot wounds. This is the entry point. Bullet is the entry point, and that's the stab
That will hurt.
stab wound. Yes, that's how. So entry point is always small, and the exit point is always this much large.
Can you just move it? Can you hold it? Can you put it straight? Can you hold it straight so that I can make the light? And this gun thing, shot.
Yeah, gunshot.
So if it is a different gun, does
Yeah.
it matter?
Yes, yes, yes. No, no. For different guns, different types of gunshots.
And this is a cut.
Yeah, this is the amputated arm trauma where you have, leg might have blown up because
what,
of.
what is this part?
This is amputated
No,
stump.
what is this part?
Stump. This is knee here.
This is the knee.
This is the thigh. And here you got a stab wound.
So where do we have the bone? Is that the bone?
Bone is one. This one,
one
yes.
is the bone.
Yeah. And then this comes
Where's
with.
the, what do you call it?
It's gone. It's blown away. You are
You
here.
mean a mine or something?
Yeah.
A mine blast.
Mind blast, gunshot wound, battlefield injury.
We take it from there. That's
Yes.
it.
So these are the different tubes, each of the tube going into all these
It will be visible
openings.
here.
Yeah. So we pull up the simulated blood, fill up here, and compress it here. No, we didn't fill it. And we compress the air inside, then it starts to flow automatically.
Blood here.
Yes, it's blood will coming profuse. Bleeding would be there, and then we can control. If we want to have bleeding in all three places, or if we want to remove, we don't want them to bleed here. They can put up a tourniquet and compress the system, and the bleeding would stop. Yep.
And for arms also.
Yes, yes. We haven't
all
put that
body
model. Yes.
Head injury bullet in the skull.
Yeah, it's a gone case. We have that also as well. Yeah.
It's an
Those are used by military. Yes. Medics. Yeah. Yeah. So here, yeah. So this whole system is one system here. So this is our Atlas Junior pediatric life support trainer. So we have this full body mannequin here, and that's the control. A faculty would use this tablet to control the vital signs of the patients. In here, you will see the vital signs going on.
It's connected.
Yeah,
Like in the
yeah, and yeah, yeah.
here.
So you can do CPR on this. You can yes, you can intubate this, put a tube inside, and yes,
The jaw.
jaw,
When somebody is alive.
uh,
Jaw.
jaw.
Somewhere like
Yeah, yeah,
then also simulator essentially orthopedics.
yeah. You want to stabilize the neck? Yes, that can be done. You can use a collar, or to save the person from further aggravating issues. Yes, yes.
How do you so,
Yeah,
so like
yeah.
we are talking with the feet.
Yes,
So when child children are born with a flat foot or something.
yeah.
So how does that is that also part of
Training, yes. So for that we have another mannequin, not in this one because in this one there is already arches are there. The plantar arches are already here, so it's a normal thing here.
one
We for that flat foot we have other different mannequins where we can demonstrate the flat foot presentation, our flat foot appear. Let me introduce Mr. Akim Buslov from Germany. He's here with us today. Akim, would you like to say a few words?
It's a great opportunity for us to be present at this Congress. So it's the first time that we are participating at the Nursing Congress in India, despite our presence since more than 20 years in the Indian market with our products for medical simulation, and hope we can contribute to the development of the health system of this great country.
My last question to you is: we are in wartime. We see the World War I, we see the World War II. So this is right now we are working towards peace. But as Vishal has shown me, the amputated leg piece, and anything which is can happen, it can be an artillery gun. So since you said 20 years, so how you see our landscape going in the next 50 years from now?
Let's say
Technology, I say, how does technology going to
technology will continue to develop fast, but technology is not everything. As we can see that mankind is behaving like the silly fools in other aspects till today, as we can see everywhere in the world.
So I think we landed at this. And my friend gentleman from Germany, so I'm wishing you all the best. See you soon. Thank you.
Thank you.